This is Dr. Jennifer Bolins of Well Woman MD, and I am coming tonight to talk about with an expert who's an ophthalmologist as well as lifestyle medicine, in the process of being trained in lifestyle medicine, but her expertise is in inflammation. So today we're going to just kind of talk about inflammation. How can you start the journey to decrease the inflammation in your body? What is inflammation? Because some people may not even know that. And just kind of have a great conversation about what you can do to start things off. So thank you very much for joining me on this Facebook Live.
Thank you, Dr. Jen. This is a great idea. And I mean, we can all learn from each other and just kind of further our knowledge and help everyone along, including helping ourselves.
Yeah, and that's kind of the idea of why I bring people on, is just to, women teaching women, right? We learn from each other. I learned a bunch from you when you were talking to me and interviewing me. So let's just kind of constantly try to bring other people into the conversation so that we can learn from them and they can learn from us in those things. So what do you do? Let's talk about what you're you're an ophthalmologist, but you have a passion for lifestyle medicine. So you have a passion for talking to women about how to live healthier lives. So how did that journey start?
Well, the journey into lifestyle medicine started with my own health problems, and we can talk about those. That's a really long journey, but I've always been interested in inflammation. When you asked me to do this talk, I started thinking, like, even way before I thought about lifestyle medicine, and when I was first in ophthalmology, inflammation of the eye actually really interested me. I had my first research project in ophthalmology was on inflammation in the eye, which is called uveitis. So there's a lot, and I have a publication about that. So we can talk lots about inflammation in the eye too. So my journey for health is, you want to start there or?
Sure, yeah.
So I think as long as I can remember, I've always had stomach issues. And our first line of defense on the outside is our skin, and our first line of defense on our inside is our gut and the stomach. And even as a little kid, I always had kind of upset stomach pain. And then, it really came to a head when I was in fellowship at age 30. I got pregnant and had just severe inflammation, diarrhea, lots of problems with that pregnancy. And I lost that pregnancy, and that taught me a lot about, well, actually that was a very sad experience, but I didn't learn from that experience until 2 years later when I got pregnant again with my daughter and went into labor again halfway through, and just stopped working and decided to read and learned about how gluten causes so much inflammation. It can basically cause miscarriages. So gluten is a highly inflammatory substance found in wheat products, and it depends on the person. Of course, there's a range of gluten insensitivity ranging from celiac disease to celiac or to non-celiac gluten intolerance, as well as a wheat allergy, which all can manifest separately. But being gluten-free, my inflammation has been controlled in my gut. I was able to have a healthy child. I have 3 children now, and all of them, have benefited from me being gluten-free.
Sure.
Inflammation in terms of illness, I was always sick, even when my kids weren't sick. I had a lot of chronic mucus congestion. Being gluten-free has helped that as well. So that's my personal journey. And then being lifestyle medicine based really means talking about the 6 pillars of lifestyle medicine, which are all the common sense things that we all know about, right? Eat more plants, a whole food plant-based diet, get your physical exercise, which is everything. Everyone needs more exercise. Get your 8 hours of sleep. That helps, sleep helps so much inflammation. I can talk about eye conditions, and I would love to actually talk about eye conditions, including uveitis, glaucoma, and macular degeneration, and cataracts, all the biggies as we go through. And Go ahead. You're going to say?
Yeah. So, I mean, I think you're hitting that nail on the head where gut health, I mean, we don't think about it as much as patients. We don't think, oh, our gut has anything to do with why we don't feel good or why we might have fertility issues or why we have chronic mucus, like all these symptoms. And you're completely right that the gut has a lot to do with it, inflammation. So when you have inflammation in your gut, you essentially have all those things sort of causing you to have a leaky gut. And then you just don't absorb those nutrients appropriately. You don't get things in that you want to get in because your poor gut is just struggling to do that. And I'm sure in your field, you constantly see, I mean, the eye is just one tiny component compared to, like, you have all these women who have these other chronic illnesses that probably don't connect the two, right? They probably frequently are like, what does my diet have anything to do with my eyes? They're totally separate. Like, like why are you talking to me about my nutrition when I'm here for my eye appointment? And I think a lot of women don't make that connection. Do you see that in your clinic and you're with clients that they don't sort of see that connection between the gut and other problems?
They don't, they think about like, well, I'm going to get my eye exam just because my primary care doctor said I should.
Yeah.
And they don't think about what the doctor's going to find there. So like diabetes is a great example. I
Yep.
always love to tell patients that diabetic retinopathy is actually a sign of what's going on in your entire body. That's why your primary care doctor cares about diabetic retinopathy. Because the blood vessels actually get damaged by that high blood sugar. They start leaking in your eye. And obviously that can cause vision problems, with macular edema being the main cause of vision loss in the center of your vision in a diabetic. And obviously as it progresses, or maybe not obviously, as it progresses, you get more and more bleeding inside your eye, low oxygen states, and then new blood vessels forming. But back to what you were saying, your primary care doctor cares, yes, about your vision, but they also want to know what's happening in the eye because it tells them what's happening in the rest of your body. I mean, the eye is the only place we can see nerves and blood vessels. And if it's happening in your eye, guess what? It's probably happening in your kidneys and your heart. So recommendations to get an eye exam annually for a diabetic is not just for your vision, it's overall. So yeah, the eye can tell you so much about the body.
Yeah, and even people who don't connect it, like rheumatoid arthritis patients, like they may not connect. Diabetics are pretty good about constantly being reminded about their eye care and those things, but some people with some chronic inflammatory conditions probably don't always sort of hit that and go, well, I mean, what does that have to do with my joints? Like what, just because I have to see the eye doctor because they want me to come by and do my yearly what does that have to do with it? I think sometimes those connections are harder to make, don't you think?
That's true. I mean, I'll give you an extreme example of a patient who came in with nodular scleritis. So she came in with eye pain. Her rheumatologist sent her to me with rheumatoid arthritis. And there's so many ways it can manifest in the eye. It can lead to like a melting corneal ulcer. It can cause scleritis, which is inflammation of the white part of the eye. And she had these like big red bumps all over her sclera. And I'm so proud of this patient, but I talked to her about inflammation systemically and how it's affecting her eye, how if we don't get it under control, what could happen to her eye. Talked to her about a whole food plant-based diet. Didn't really know what she would do. Of course, we treated her inflammation with the rheumatologist with other immune suppressants like prednisone and whatnot. But she went vegan and whole food plant-based the day I talked to her. I had no idea. When she came back for her follow-up in 2 weeks, her eye inflammation was so much better. She had lost like 20 pounds in 2 weeks, and she said her joints felt better, and she was able to decrease her oral prednisone. So, and in total, I think she lost like 65 pounds over 2-3 months, and she's kept with a whole food plant-based diet over the last year, and she feels amazing, and she's had no flare-ups in her eye. So that's a significant one.
That's amazing. And she probably feels great in her joints because when you lose 60 pounds, you're going to feel fantastic when you're walking around,
And I give her all the credit, right? I'm just educating, but she took what I said to heart, researched it, and just did it and went for it. So that's all on her, and she gets kudos. That's the most extreme example that I can share. There's other smaller examples. Did
Yeah.
you know that inflammation inside the eye can also be worsened with smoking? I really want to talk about smoking because
Yes.
I'm really passionate about,
Yeah.
one of the other pillars of lifestyle medicine is avoiding toxins or substances that can cause inflammation. And one of the main ones, yeah, we love to talk about food and dairy and gluten, but my biggest one is smoking. Like if you are a smoker or exposing yourself to tobacco at all in any way, you must figure out a way to stop. And a light bulb went on for me about a month ago when I was talking to a patient who had quit smoking successfully about 10 years ago, well before I met him. But he said, his mother was a smoker.
Mm-hmm.
And when he had his first cigarette at age like 13 or 14, he said it was the best thing ever. And that really shocked me. But then when he went on to explain it, he said he had gotten into a group, I think called Narcotics Anonymous, which I never knew existed, kind of like Alcoholics Anonymous. And they shared with him that nicotine dependence actually was formed when he was in the womb.
Yeah.
So that was a huge light bulb for me that addiction could start in the womb.
Mm-hmm.
And we know in lifestyle medicine that maternal diet, even paternal diet, mom and dad's diet affects the babies, can affect the genes. Your DNA can affect the epigenetics of how that DNA is expressed, in terms of causing inflammation and cancer. But it was just so shocking to me that I never realized that dependence can start in the womb. And, he smoked for probably a good 40 years. And then he found that wonderful group of the Narcotics Anonymous, or not Narcotics, sorry, Nicotine Anonymous. I think we can look up that group, which I had no idea existed, and they helped him quit. And he has been done smoking for over 10 years, which I commend him for that too. But for inflammation overall, we know that smoking causes inflammation in your lungs, right? It can cause asthma flare-ups by causing exacerbation of the lining of the lungs. It can cause COPD, and we know it's one of the main causes of COPD. In the eye, there's many studies showing that inflammation inside the eye, which is uveitis, which I can actually see inflammation. When patients come to me and they have uveitis, I can actually see white blood cells floating around in the front part of the eye, and I can tell them how bad their inflammation is, how the treatment is working.
Yeah.
So, but anyway, it's been absolutely linked to smoking, that uveitis can be worsened with smoking.
Yeah, I mean, that makes sense because you see that history. You typically see like women who are smoking have kids who smoke eventually. So they, it can't just be like they came out and they live in an environment where people are smoking. Like there has to be more to that story than just they happen to be in the household. You know what I mean? That they ultimately end up.
Me that dependence start that soon, but it totally makes sense.
Well, a lot of studies have been done on women who, like, say, have depression. Like, say, if you have depression as a pregnant woman and you don't get it treated, that those children long term have issues with, mental health, that have higher rates of having anxiety, depression, those same symptoms. So you almost wonder whether or not it is an imprinting phenomenon. Like if that woman is so high, her cortisol levels are so high because she's stressed out and all that inflammation is going on because of her anxiety and depression is not treated. And ultimately their child ends up having higher chances of those things. You could see in other behavioral problems how they may also be the same. Do you know what I mean?
I mean, you bring up such a great point. You just made me think of something that I've actually never thought of before is, could inflammation like rheumatoid arthritis or whatnot be predisposed from something that the mom is exposed to when they're pregnant with the baby? Could inflammation be linked to something in pregnancy? I don't know the answer to that. I've never thought about that before.
Yeah, those studies are hard to do, and I've looked these things up before because it's hard to keep things separate, right? It's hard to say someone who's a smoker but doesn't use any other substance or doesn't have stress or doesn't have anxiety or doesn't have, it's hard to, those studies are difficult to piece out what is not a confounder. And then also, I mean, as you know, like studying pregnant women is very difficult because companies don't want to be involved with pregnant women. Pregnant women want nothing to do with, any kind of research on them and their baby, because, you don't. So that's even in, drugs that we talk about in pregnancy, it's just difficult to get any trials done because people just don't want anything to do with each other, drug companies and pregnant women. So I don't know, that's a good question. I probably need to do a little digging on that myself to figure out, is there any, I know there's lots of good information on behavioral issues, anxiety and depression that's untreated. That's why ACOG, our society, has really gotten much more focused on treating women with anxiety and depression during pregnancy and not letting them sort of tough it out per se. But that would be interesting to see what there is available for inflammation. Like,
wow,
the States.
Thought.
Yeah.
But smoking is like just something to address right off the bat. We know it causes inflammation. So smoking in pregnancy, maybe also leads to some contribution to autoimmune conditions later on in life. I mean, these are not things we can control for ourselves or the past, but certainly for the future, our children and their children. Some of the studies in lifestyle medicine show that the epigenetic changes that occur in pregnancy, especially with diet and alcohol and tobacco, can last up to 3 generations. I'm not really sure how they determined that, but when I read that, I was just shocked. 3 generations.
Yeah.
So it's so important to take care of ourselves.
You said the pillars of lifestyle medicine. Do you mind saying what they are for people who don't know what that means, or what?
Honestly, it's all the simple stuff. It's the whole food plant-based diet, number 1. Number 2, physical activity. Number 3 is 8 hours of sleep. Number 4 is avoidance of toxins or risky substances such as tobacco and alcohol. Number 5 is stress management. And number 6 is like other social support. So, I mean, we all know all the 6 pillars just innately, like that's what makes us happy and kind of live a well-rounded life. Lifestyle medicine is a great new field that has kind of listed them and quantified them and helped look at the evidence-based medicine for supporting all of them, which hopefully it's already common knowledge, but just adding that evidence-based information is solidifying the principles more and more for me and making me follow them as much as I can.
Yeah, and everything you just mentioned are all ways to decrease inflammation, right? All those particular things. Do you have any, like exercise-wise, do you have anything that you think is a better thing for people to do for exercise? Or do you have any, do you have recommendations that you tell patients about certain types of exercise that relate to their chronic condition?
I wanted to go back to smoking for eye conditions, a couple
sure.
of things, and then we can move on to exercise, because glaucoma is the number 1 cause of irreversible blindness in the world. And your risk goes up with age, 2-fold when you're about 50 and 10-fold when you get to 70 in every single person in the whole wide world, including me. And glaucoma is absolutely made worse with smoking. So the progression of your glaucoma will absolutely get worse and worse as you smoke. So, and how does it manifest? It's damage to the nerve in the eye from eye pressure that's too high for each person. So each person's eye pressure is individualized to them. And, it starts in the periphery. You get peripheral vision loss to central to total blindness. So we want to catch it early. That's why the screening guidelines are there to get your eye exam starting at age 40 routinely, and every single year after the age of 55 to look for glaucoma, which is irreversible. The other big one is macular degeneration. Smoking is the number 1 non-genetic risk factor for macular degeneration. And macular degeneration, the macula is the central part of your retina, the film of the eye that helps you see. And macular degeneration, it just starts the breakdown products of the photoreceptors start building up and can lead to bleeding inside the eye. And smoking absolutely causes the progression of macular degeneration to central vision loss much, much faster. So if you can quit smoking and you have any genetic risk factors, or even if you don't have genetic risk factors, you will decrease your risk of ever having that disease.
What do you tell people if, like patients, they say, okay, great, let's do it. Now, what do you say? for
Well,
quitting smoking? Would you have any sort of tips that you think work better, or what do you think?
for smoking, I
Stopping smoking.
think just my educating them will motivate them to take action, because number one in making any sort of change is just setting your mindset, right? If you have the right mindset, you've committed to the goal, then you're going to take action, right?
Yep.
That's the health belief model, in looking at how our human brain works, right? If there is a threat to our health and there is something that we can do to fix it, then we will take action. And if I can demonstrate to patients how much whatever they may be doing, smoking or eating processed foods or processed meat or whatnot, affects them, then maybe they will listen and take action and reach out to additional support groups. So as an ophthalmologist, I do spend a lot of time educating patients, but I don't have the resources set up to directly refer them. I do have a lot of links on my websites, so patients can get to resources that they can help each themselves with.
Sure.
What will you tell them?
Usually, so the key, it seems like, from smoking cessation is setting a goal and a deadline, right? Coming up with, this is my goal. This is my quit date. I hope that I'll stop by December 1st, for example. And, also building in a little bit of grace that, it's hard. Quitting smoking is very hard. And, for some people, cold turkey works. For some people, they need to join a support groups. For some people, they need to use nicotine patches for, kind of recognizing. I think when I usually talk to patients about stopping smoking, I try to figure out, is there a behavioral component related to it? Because a lot of patients will say, well, I only smoke when I eat, or I only smoke when I wake up, or only when I go to work and they stress me out at work. So I try to figure out if it's a behavioral component. It seems to me they're more successful if they have something to do instead of that behavior. Maybe it's nicotine lozenge or gum or meditation or music or whatever sort of behavioral change they can make in substitution for it. And if it's truly they smoke 2 packs a day, they're probably going to need some help, like some nicotine replacement therapy to help them, because ultimately that's a hard habit to break, especially if you've been doing it for a very long time. So a lot of times I talk to people about what is the, what does it do for you? What is it associated with? Just try to see, can I give them some resources? And then, occasionally there's that patient who's like, I'm done. Today's my day. And they do it, they just rock it. But a lot of people, just like losing weight, it's a process. It's not I want to do it, so today it's going to happen. You usually have some stumbles along the way. So you have to kind of find whichever avenue is going to work for you. If it's accountability, if it's just setting a day that this is it, if it's, having your partner quit too, what is the, how is it going to work best with your style? Because I think that's hugely important, not to feel like you're by yourself trying to do it.
You have to make that commitment. It has to come from inside. But
definitely.
Them and help them anyway. I love that group that patient told me about, the Nicotine Anonymous group. I mean, I think groups like that are just so essential, and hopefully we can spread the word about them and help more people quit smoking.
Well, and anytime you can connect with people who are going through the same thing as you were going, that usually works a little bit better, right?
Right.
It's always easier to understand the pitfalls if you have some other friends who are having the same problem to guide you through it, as opposed to you thinking you're the only one going through these feelings about whatever intervention that you're trying to do.
Same goes for alcohol too. I'm always looking up alcohol and inflammation, and macular degeneration is thought to be an inflammatory condition, and alcohol is definitely high amounts of alcohol, not a moderate amount or a low amount. The high amounts of alcohol is definitely linked to progression of macular degeneration to central vision loss. So that's another one of those toxins, avoidance of risky substances. I won't talk too much about alcohol, but I wanted to just sneak that in about that.
Although we're allowed to have our glass of red wine, right?
No, yeah, moderate is fine. We're talking about high consumption of alcohol.
Yeah. Yeah, I was going to say there's a lot of stuff lately on about, a glass of red wine and sort of the health benefits, the heart benefits, and the, Yeah, decreasing inflammation benefits of sort of that clearly moderation, but also just red wine in general, which is kind of an interesting thing. Thank goodness. I think you said something that I think is really important that I did not value at all until recently, which is sleep. Like sleep and how that contributes to all health conditions. I mean, it doesn't matter what kind of health condition you're talking about. I don't think until I got a little over my 40s that I decided that actually that is a big component. Like if you're trying to lose weight or if you're trying to wake up rested, like you really got to have a good sleep routine. Like you can't decrease the inflammation in your body if your body never resets from that standpoint. What is your thoughts about those things?
Well, I was doing a search for our talk today about sleep and inflammation on PubMed, and I found that sleep deprivation is associated with higher levels of CRP, which is an inflammatory circulating, is it an enzyme? I feel like C-reactive protein.
Mediator, yeah.
So it's a much higher level of CRP in our bloodstream if we are sleep deprived. And sleep deprivation in that study was defined as less than 6 hours of sleep. So, and then the lowest levels of CRP were if you had slept 8 hours or more. And then additional beyond 8 hours did not reduce the CRP any further. So you don't have to go to 10 or 12 hours or something like that. And higher CRP, as we all know, is linked to a higher risk of cardiovascular disease. And then obviously, well, not obviously, but sleep helps your immune system fight inflammation. It helps the cytokine responses. We know that inflammation can also be a pathway to lead to Alzheimer's, which is, Alzheimer's dementia, and sleep deprivation is linked to inflammation that may progress to Alzheimer's. Let me see what other things. I'm trying to remember. I'm going to read my notes here because I did research for you.
The reason why that I brought this up to you was I've taken this integrative nutrition class at Institute of Integrated Nutrition, and they were talking about how people who don't sleep, like so say you're up all night on a call shift and you tend to eat poorly with that sleep deprivation because it causes those digestive enzymes, those hormones that sort of tell you I need to eat crappy to go up like ghrelin. And so you're like, you're sleep deprived and then all you want is a donut, as opposed to I'm going to have some eggs and toast. And so it's sort of, you can see where this could become like a cascade issue where you eat poorly and then you set that day off with, your body kind of in, that higher cortisol, oxidative stress level because you just started the whole cascade of eating crappy, then you take too much coffee, then you don't get your sleep, then it just turns into this, like problem. And so I brought that up to you just because I had seen that thing talking about weight loss, because I do sometimes have patients who are like, why can't I lose weight? And like, what's the deal? I'm in my 40s. I know it's supposed to slow down, but there's got to be something else. And so when I start talking to them about, well, what is your sleep routine? Like, do you do yoga? Like, what kind of meditation do you do? People are always like, what are you talking about? Like, that has nothing to do with weight loss. And so I've learned to value and appreciate that more now that I have read a little bit more about kind of how those things actually do help with weight loss, help you kind of maintain your good balance to begin with. So yeah, I thank you very much for bringing that to my attention too.
Yeah, it's one of the pillars of lifestyle medicine. If you want to hear a little bit more about sleep and the eye, a few things. One is sleep apnea. So when you're kind of a low oxygen state, it is linked to glaucoma. There's some association there. So treating your sleep apnea is important, especially if you have glaucoma, and listening to your doctors there. Interestingly, there's some association with glaucoma progressing more on the side that you sleep on. So there's some gravity association perhaps. So sleeping on your back is better if you have glaucoma. And then there's some association, again, with less than 6 hours of sleep with progression of macular degeneration to the neovascular or wet type because of that increased inflammation. And these are all studies that are, peer-reviewed, published studies that I was reading for our talk today on PubMed. So those are all eye conditions. And then one big one that I see all the time as a dry eye specialist is dry eye, because patients, two conditions. One, where they don't sleep with their eyes completely closed, and that's more frequent if they're getting like shorter kind of sleep cycles and they're not fully rested and they didn't do their pre-sleep routine. And I want to talk about the pre-sleep routine.
Yes.
So
Yes.
they're sleeping with their eyes partially open. I've had patients come in, young patients in their 40s, with a corneal abrasion, so just a scratch on the surface of the eye from sleeping with their eyes open. And they said, "Oh yeah, I fell asleep, and I wasn't, in my normal sleep habitat or in my bed. They were on the sofa or something like that." So, and then the other one would be people who have that sleep apnea machine, and the air is blowing and pushing their eyelids open while they're sleeping. And then they wake up with gritty and kind of dry, watery eyes, and they don't understand. And that one's not associated with a lack of sleep, but more mechanical. So
like poorly fit machine.
What's that?
You mean like it's poorly fit on their face and so it's not.
I don't know the mechanics of it because I'm not familiar with it, but I have so many patients, like if they come in with dry eye, especially in the morning, and they tell me, their eyes are burning and gritty and they have to use drops every morning, my first question is, do you sleep with a CPAP machine?
Yeah.
Because just maybe putting an eye mask over their eye can help relieve all of that air flow to the eye. And there's some specialized eye masks for certain patients. But I always talk to them, if they don't sleep with a CPAP, and they're sleeping like 3 or 4 hours. I have a lot of 70-year-old, 80-year-old patients that sleep only 3 to 4 hours. Yeah. It's so surprising. And then, so I talk to them about their sleep routine, kind of putting away all devices an hour before you go to sleep, trying to set the same bedtime for every night and do a wind down routine, just like we do for our kids. It's important for everyone, whatever fits with your routine the best. Maybe a gratitude journal, maybe some meditation, maybe some stretching, and then just kind of no electronics for at least a half an hour to an hour before you sleep will really help you sleep a lot better. And that's helped a few of my patients, just that simple tip.
That's a wonderful tip. Yeah, that's fantastic. And since you mentioned, do you have any other tips and tricks of the trade that you want to share with women who are trying to optimize their health, that are trying to just start from the basics and say, how can I decrease my inflammation to live better?
Well, you asked about exercise earlier, so I want to go back to that question. Sure. So exercise, the lifestyle medicine recommendation is 150 minutes of moderate exercise where you can talk but not sing. So that's moderate exercise per week. And that seems like a lot, right? It's like 30 minutes for 5 days a week. And sometimes in a busy schedule, you're like, I just can't get in 30 minutes. But the studies have shown that if you can get at least 10, ideally 15 minutes together, that's even beneficial if you can't get to the 30. And if you can get maybe 2 days where you get 2 15-minute blocks or even 10-minute blocks, that's better than, no days with any time. So you can't always look at that large goal of the ideal 150 minutes per week, although that's where we all should be. I'm just not getting there. But if we can get to 5 minutes or 10 minutes or ideally 15 minutes, we really see a huge benefit of exercise daily. And then try to go for the 150 for the week. Just talking about inflammation, exercise helps treat your cardiovascular disease, so it's another anti-inflammatory. It's even been studied to help protect against macular degeneration. It's neuroprotective. I looked this up, and it helps, including decreasing risk of Parkinson's and Alzheimer's disease. So, exercise is definitely very important.
And we also know it helps anxiety, depression. It helps mood disorders, right?
That's super important. You're right.
Yeah,
go ahead.
I also usually tell patients, like, moving, whatever way you want to move is fine with me, like just doing it. Go play soccer with your kids, go walk, go, do planks, whatever like whatever you think is sort of the thing that gets you to do it is important as well.
And back to that, like you said, planks, so the 150 minutes is actually like aerobic exercise, but there's recommendations for 2 times a week for strength training and 2 times a week for kind of stretching and flexibility training. So all of those, we can get help from kind of health coaches or PT or you or me as well to kind of fit all that in. It almost becomes a full-time job taking care of your body, but it's totally worth it. I mean, it's the only body you have. It's the only body you're going to get. So what's more worth taking care of than your body, your one and only body?
Yeah. And if you take care of your body, the rest kind of falls nicely into place, right? You have better relationships with people. You usually do better at work. I mean, all those things kind of fall into place when you don't wake up feeling miserable, and continue your day the same way. So you see that, I'm sure, with patients too, who optimize their health and they feel like $1 million in a lot of areas in their life.
I mean, it's certainly been true for myself, changing my diet. I feel like a totally different person. And people tell me all the time, like, you look like you're getting younger. How is that possible? And I totally feel younger since I've changed my diet. I'm mostly plant-based. I don't eat any processed meat. I don't eat any meat except like maybe once a month, some fish, and then my omega-3 fish oil supplements. But it's totally changed the way I feel. And apparently it shows in my skin and other things too. So
yeah, no, I mean, it does. I think that's definitely a huge component is your wrinkles and your skin and your breaking out when you get into your 40s. Like that all is better with going to a clean food eating diet, whether it's plant-based or mostly plant-based, for sure. There's definitely good information on that. Where do you think people should go to for resources? Like if they wanted just to start off and say, now what do I do? Like I heard what you said and you're wonderful. Now, where would she tell me to go to get started? To do ways to
could figure out what your learning style is the best. Some people learn best in person, kind of one-on-one coaching. Some people learn best with like an online type of course format where nobody's looking over their shoulder and they can kind of do what they need to do, or other people want accountability. So, lifestyle medicine talks about having kind of prescriptions for lifestyle. So a prescription for nutrition, like please add 1 cup of greens to your meals 5 days a week. Please add 1 cup of legumes or beans to your meals 5 days a week. So if you need that kind of written prescription to yourself, those are ways to benefit. Same thing with exercise. I will, and writing it down and posting it where you can see it, I think really helps a lot. But figure out what works for you and look for community resources. And then I love pointing people to Dr. Bernard and Dr. Campbell's websites because I think they're just so inspirational. Dr. Colin Campbell has his Nutrition Studies website where he has hundreds of stories of people who've adopted a whole food plant-based diet and how they've changed their lives. I think stories just inspire us to make changes and little tips and recipes. Dr. Bernard has his website, the Physicians Committee for Responsible Medicine. He's got so many resources there for both physicians and patients, including like a 21-day kickstart to a healthy whole food plant-based diet. So those are my 2 big favorite resources to recommend.
Perfect. Well, how can people find you if they want to learn more about you?
If they want to find me, I'm doing videos just like you are, just kind of spread the word and educate. I've got 2 websites. One is my ophthalmology website, eyedoctormd.org, and you can learn lots about eye conditions. And there's a link to my other website, healthylifehealthyeyes.com, where I'm putting together kind of modules for patients to learn a little bit more about the pillars of lifestyle medicine and help them. There's little homework modules as well to help them kind of get going and move forward. And then, of course, you have your modules, and I have sent patients to your website. So we're all working together to educate all of us to just get us healthier.
Yeah, I mean, I think that's fantastic. People have an option to read and on their own, which is sometimes a little bit easier in a busy, crazy life to figure out how to slowly do it yourself. I think you're right. Your learning style is what you got to figure out first. Like, what is the way that you typically learn? Are you somebody who doesn't read, but you want somebody to call you out on things, or do you need somebody to check in with you, or just do your own self-paced course or module?
Really important to reach out to your primary care doctor too, especially if
Yes.
you're on multiple medications. You've got to get them on board. So any changes you're making, they can help you adjust your medications and you don't get into any problem areas. So
Yeah.
maybe start with learning and then go to your primary care doctor and come up with a plan together and just take action.
Yes. Don't forget the captain of the ship, the primary care doctor. I tell people too, whenever we talk about things, I'm like, just bring your questions. Bring the point of the education is to break stuff down and bring it to them and say, does this apply to me? Like, is this about what I should do? So definitely, I always encourage people to have conversations with their primary care doctor. And as a doctor yourself, you probably like when people bring that in the loop of the conversation. You don't want people to be doing particular diets and you have no idea if this is affecting their medication management or any other decision. So I always think it's important just to be honest with it and bring it to their attention. And maybe they're doing their own lifestyle medicine, and so maybe they have some great tips too that they can share. You just don't know till you bring it up and ask.
Well, it's a huge movement. I love integrated medicine, lifestyle medicine, functional medicine. I think this is the future of medicine, preventative care, and moving from the care model to the cure model to reversal of diseases rather than just throwing medications at diseases. So thank you so much for all that you're doing and kind of spreading the word, and we'll just keep going together.
Yeah, thank you. Thank you. And when we end this live, I'll put on the link your links to your website so people can check you out. And do you want your YouTube link on there too
Sure.
Yeah.
Send me messages. I'm not, I probably will take 1 to 2 days to respond to messages, but I do respond to messages as well. So
perfect. Was there anything else that you wanted to say before we end this fantastic conversation?
Spreading the word and making me do research. I learned stuff when I was reading for this talk. So thank you so much.
So I'm going to end the Facebook Live, and obviously like I said, I'll make those links on the Facebook post once it saves, and so we can, clients and people can check you out, and then they can decide if there's some awesome things they want to refer their friends to talk. Do you do telemedicine, by the way, just for other people who are not in your state?
I do telemedicine, yes.
Okay. Well, perfect. That way if someone wants to see you, then that's even better. All right. Yeah, thank you. I'm going to go ahead and click off.